All right, welcome to Module 4. If you're watching this module, you have completed Module 1, your evaluation. Module 2, you looked at your recovery program and see what type of recovery program that you're following. You've also seen Module 3. It has covered the specific recovery tools specific to your addiction, be it alcohol, drugs, gambling, compulsive spending, hoarding, whatever. This module, Module 4, is basically the final step in recovery from addiction for anybody. The majority of people who have an addiction, be it to a chemical substance or a behavior, they've got some problems in their lives. If you don't, great, you don't need this module. If you do have some issues, at least be open-minded and listen to some of the statements we're going to make here, because what I'm going to tell you basically is things that I've learned over roughly a quarter of a century in dealing with alcoholics and drug addicts. And, these issues may be related to your relationship with your wife or your family, your kids, maybe the neighbors, I don't know, your employer. You could have some serious legal issues. You could have problems with the federal government. Who knows? Maybe you got tax issues because of your addiction. Maybe you're looking at prison time. I don't know. Maybe you've estranged your significant other. Maybe you're in an emotional state where you're an emotional cripple. You don't know what to do next. You don't know how to get back into a normal life. So let me just give you some basic concepts here and some basic recommendations and ideas that I found that's been very helpful in folks in cleaning up this wreckage of their life. So, based on how serious your issues are and the significance of them in your life, there's certain things you might be able to do. I have found the most important thing a recovering alcoholic, addict, or someone addicted to behaviors can do if they're trying to prove to anybody that they're doing things right is to document what they're doing. This documentation could be anything from a simple signed AA meetings, 12-step meetings, NA meetings, CA meetings. Any kind of a counseling session that's entered into is very important relative to documenting what you've done. The first thing you need to do, and if you're watching Module 4, you've hopefully already done this, is if you have questions about your issues relative to addictive disease, have an evaluation on hand. And having an evaluation on hand, documentation that you're looking into these problems and trying to see what your situation is very significant for a human being. In other words, these people know that you've got these issues. If you have issues with regards to problems with your job or other people like this or people who have difficulty believing you, having your recovery program there to show these folks what you're doing is a big deal. I mean, in other words, you have a problem, and whatever your problem might have been, you probably had it for 8, 10, 12 years maybe, and your way really didn't work very well, did it? Well, if you have a recovery program in hand to show these folks, be it your employer, your probation officer, or your wife, say, hey, I've got a recovery program. I have a blueprint for success. This is really important to show folks. Another thing that's good is to show that you're doing something in your disease in an ongoing fashion. In other words, you evaluate it, you got this recovery program, and you have an ongoing way of treating this problem. You see, this disease just doesn't go away overnight. Once an addict, always an addict. In other words, alcoholics still go back to social drinking. Pathological gamblers don't go back to normal poker, okay? Sex addicts don't go back to normal viewing pornography, for example. So whatever your addictive disease is, you're in for the long haul, and having a recovery program in hand shows that you've got a significant situation relative to your sincerity and veracity. Also, having a mentor or a sponsor, having some sort of a counselor or 12-step guide is a big deal. This could be somebody through church, it could be a counselor, it could be a social worker, it could be your sponsored 12-step program, proving to people that you have somebody to more or less help you relative to some sort of support and infrastructure demonstrates to not only your wife but your employer and your probation officer that you have somebody kind of being your guide through this difficulty. I've also found it's very important that get into some sort of volunteer work. No matter what your addiction may be, if you get into a volunteer work, it gets you out of yourself and it shows that you're willing to pay back. It brings a little humility into your life that's also significant and very, very important. Frequently, if you're in a very dire situation with regards to your family members, legal, whatever your difficulties may be, you may need to be in an assisted living program. This is an extreme situation, but your situation may be extreme. For example, you may have to learn how to reconnoiter your life in the social aspect. Assisted living, halfway house living, sometimes may be significant. Also, it's important in recovery. If you have any sort of if you have like a concomitant diagnosis with a dual diagnosis with a mental health issue, make sure that you're getting help in your mental health issues and you're seeing a mental health professional as well as somebody who can deal with your addictions. So if you have severe depression, anxiety, bipolar disorder, or something more serious of mental health disorders, make sure you're getting dual diagnosis treatment if that's a particular case. Also, if you've been prescribed medication by a healthcare professional, that's appropriate for your situation, make sure you're taking the medication as ordered and you're following doctor's advice. It's very important that anybody who has these issues in their life, they're going to need some sort of insurance on their recovery. If you want to keep your life running on a straight course, headed the right way, relapse prevention programs are very important. In other words, recovery just doesn't happen by itself. It's an inside job, and you have to work at it. The recovering person, no matter what their disease may be, you just don't sit there and say, okay, keep me clean and sober. It's a 24-hour-a-day job, and you have to do a little effort on this. So recovery programs and relapse prevention is very, very, very significant. If you do have significant legal problems, everything that you're doing needs to be documented. The documentation may be necessary not for the courts. Your job may need it. And I can tell you this much: if you document yourself, like getting your tokens in your 12-step meetings to mark your sobriety, whatever that problem may be, that's a significant documentation, a writ of passage to you. So documentation is very, very important. And another thing that's significant, if you're having ongoing cravings, or if you're having withdrawal, protracted withdrawal, see healthcare professionals for this. These things can be treated. Our Addiction Buster formulas, Addiction Buster 1, 2, and Craving Aid, can help you with that. This is a significant alternative medicine approach that works and has helped a great many people. If you prefer to go to a physician to get prescription medicine, that's great too. You want to make sure you're careful what you take with regards to addictive medication. But treat this problem long term, because you didn't get to this stage overnight, and you're not going to get clean and sober and cured overnight. It usually requires long-term treatment, and you have to be attuned to certain things such as long and short-term cravings, because they will come and they will go. So the documentation is important, and using tools for recovery, like the recovery tools that we've mentioned to you here on this site. Go back to your recovery tools, whatever they may be for your particular addiction. Use them. See how your cravings are doing. See what your evaluations are. Dissect the medical, behavioral, and social components of your disease. Are you getting better? Are you getting worse? Are you staying the same? And it just reminds you that you are a drug addict and or alcoholic and or addicted to certain behaviors. And it takes recovery to keep you clean and sober. And you can do this with the tools we've given you and with the information you've received here. Also, another significant way to help clean up the wreckage in your life and to get you in a stronger recovery position is to interact with the recovery community. You can do this through your support groups, through church, through any sort of a cognitive behavioral, and also we have a terrific support community here. We'd love to have your feedback, how this has helped you. Interact in our recovery community. Question, answers. We try to interact in these questions and answers as well and provide insight when appropriate. So feel free to come to this site, addictionbuster.org. Use us in the Total Recovery Experience. Use our recovery community. Interact, chit-chat, share your thoughts. Let us know how we can become more effective to you in your recovery, what you'd like to see from us and what you'd like to hear from us. We're at your disposal 24/7. Give us your feedback. It's valuable to us. And feel free to use every modality available to you at this site. Have a great day.